This is News in Depth with me, Efim Pandey. Hepatitis is more infectious than HIV. According to the World Health Organization, viral hepatitis affects 400 million people globally. This is 10 times higher than the number of people infected with HIV. In today's edition of News in Depth, we find out the extent of the disease burden in Zambia. Stay tuned. Few diseases are as deadly as hepatitis. But sadly, this is one disease that is not considered to be so common, and yet it afflicts and kills millions annually. Perhaps hepatitis is generally overlooked because it devastates the body silently. Hepatitis, which can be broken down into A, B, C, D, and E, is however a global health problem. Take, for example, hepatitis B. This is a life-threatening ailment because it comes in the liver and slowly decapitates it. Medical experts say hepatitis B can be chronic. That is not all. It also puts those afflicted at high risk of death from cirrhosis or liver cancer. But how is hepatitis B transmitted?
There are many ways in which patients get hepatitis B infection. Okay, so some people will get it from their mothers. When the mother who has hepatitis B gives birth, can give it to the child. Okay, others may be born without it, but during the childhood, then they are playing together as children, they may get it. Okay, others will get it through using sharp instruments like razor blades, okay, needles that are contaminated. Okay, others may get it through blood transfusion, although now that is not the case in our setup because all the blood is screened for hepatitis B. Okay, others may get it through sexual intercourse.
The World Health Organization says viral hepatitis affects 400 million people globally. This is 10 times higher than the number of people infected with HIV. Every year, 6 to 10 million people are newly infected. And every year, about 1.4 million people die from hepatitis. Hepatitis is a tricky ailment because it comes in various forms.
The A and E are transmitted through the fecal-oral route, meaning you have compromised hygiene of the hands, of the body, whereby the virus, after being shed in stool or feces, because you're not washing your hands properly, the hands get infected, and then you touch food and then eat. You are going to get infected through water, which is not properly treated, food, which is not properly handled, and just being in environments with compromised hygiene. That is a major route of transmission for hepatitis A and E.
And then hepatitis D, hepatitis C, and hepatitis B are transmitted through the same way like HIV and other, so it's transmitted through contact with blood and body fluids when those come in contact with mucous membranes or non-intact skin. So from mother to child, through sexual intercourse, through needles that are not sterile, and those are the methods for hepatitis C, B, and D.
Lusho Mohamuga Ngandu only discovered that he had hepatitis when he was referred to the University Teaching Hospital from Macha.
After undergoing some diagnosis from the doctors, and that's how they told me that it's the same problem that I'm having.
Were you feeling ill before that?
No, it just started suddenly. I just started vomiting blood while I was at school that day. Yeah, I was in class actually. But I just felt like, arousing, feeling like I want to vomit. And that's how I went outside to vomit blood. But I was just surprised because I didn't experience anything, you know, like maybe there is any sign of, there's nothing. So in 2008, that's when it started. Then I was treated there. That was about for 1 week. Then I felt okay at least. Again, I resumed training at school. Then in 2011, again the problem started. And that's how then they referred me from Macha Mission Hospital coming here to UTH for some diagnosis.
Since then, Lushomo has had to travel to Lusaka for treatment.
I travel, that's every month. Okay, they only give me for 1 month, medicine for 1 month. After 1 month, again I come, I get to collect the medicine.
How are you feeling at the moment?
No, but since I started taking the medicine, that's propranolol, up to now I never vomited blood again. Yeah, but I'm still taking them to now, but I'm okay. The problem is that, you know, in the pharmacies, they are saying they are running out of medicine. Even here at UCH sometimes, you may come, they will tell you that you are running out of propranolol. So you go in the chemistry looking for some medicine. So that's the only challenge. I don't know if they can send medicine to Macha Mission Hospital or what.
Lushomo is not the only one who was ignorant about hepatitis. Jimmy Mwanza is another. Apart from being diabetic, Mwanza only found out his hepatitis status after he was hospitalized for diabetes.
As we were coming home, the doctor phoned to say, no, you are not supposed to be discharged. You're supposed to come back. At that time, I wasn't very well. Not until the following day, we had to go back to Clinic 5, and we met the doctor. He started explaining about hepatitis. Now, I had no idea. I even refused to get the blood because I had no idea what is hepatitis. Until the doctor said, no, try to check on the internet if you got the phone, internet phone. I tried. Most I found that hepatitis A, B, C is found in India. Now, symptoms, signs, of course, I was feeling a bit of pain to my right ribs. Then I explained to the doctor, not until they got another test. After a month, so I went for biopsy, to the liver check. They find that it was some infections.
But medical experts are more concerned with hepatitis B.
Hepatitis B is actually more infectious than HIV, but people fear HIV so much. And yet, hepatitis B virus is about 100 times more infectious than HIV. If you must know, in fact, if blood contaminated with hepatitis B is left on a surface, it may be infectious even after a week. So it's quite a big problem, and people must take care not to get infected.
According to the World Health Organization, more than 686,000 people die from complications of hepatitis B every year. And an estimated 240 million people are chronically infected with hepatitis B. WHO states that hepatitis B prevalence is highest in sub-Saharan Africa and East Asia, where 5 to 10% of the adult population is chronically infected. But how big is the problem of hepatitis B in Zambia?
It is a very serious public health concern, and it's high time that we start now responding. The issue is that it's not just Zambia, it's the entire global community that has suddenly realized that this is going to be a real threat to the very existence of mankind.
In Zambia, we are just beginning to estimate the size of the problem. There are many ways in which we can estimate the size of the problem is by doing surveys, and currently there's a survey that is going on countrywide, where we are going around in the communities collecting some blood samples and testing for hepatitis B. From the indicative data that is coming back, in the general population, we should be over 5% prevalence of hepatitis B in the community.
The purpose of the research is to generate local data to help inform policies for hepatitis. So for example, we started by testing clients in HIV clinics in Lusaka because we knew that people living with HIV would already be a higher risk population. So what we did was we tested about 800 HIV patients who are receiving ARVs here in Lusaka, in Kanyama, and Matero areas, and we found that about 10 to 12% of them were carrying hepatitis B virus. And this is what we call co-infection, HIV hepatitis co-infection. And we also tested the same population for something called hepatitis C virus, which is another hepatitis virus, but thankfully, actually none of that population had hepatitis C.
So, ku patient kwanu kwachoka kulibe, kwachoka line limozi ukinangu control kulibe nishimo mulibe, but apa twachoka tubiri ku patient kuli kamozi na ku control kuli kamozi, meaning hepatitis munachani muli nayo. Mayo nayo mwatuona tutuma line tungati tubiri line aka patient aka control tulimu ilimu. So wamenanga zindikire chabe kuti muzoti zona kuti ma liver ni zankala bwino kuti kapena yachepa ya ono kama ningi ni madoktai.
How often should one be tested for hepatitis?
That's a great question. So I'll go back to HIV because I think that's where people relate to. So in HIV policy in Zambia is that every year a person should know their status, should go for testing, should go to the VCT clinic. But in hepatitis B, it's a little bit different. And we actually just recommend first everyone should get tested once. So everyone should just get tested once. It's not a yearly thing. And then the retesting comes in when you've been exposed. So if you think you've been exposed, you can get retested. But right now, I think the international approach is that in settings like Zambia, we should just try and get everyone tested at least once.
But are hepatitis screening sites readily available in the country?
The screening is universal for all those who are found to have HIV, because as you may well know that the route of transmission for hepatitis is the same as that of HIV. So whenever you see a lot of HIV like we have in our settings, most likely hepatitis B is also quite high. So we screen everyone who has been found to have HIV for hepatitis so that they can be offered treatment. However, in the general population, if you want to have a test for hepatitis B, all our labs countrywide should be able to offer that test.
Those who deal with blood know better. Dr. Joseph Mulenga is the medical director at the Zambia National Blood Transfusion Service. I caught up with him to get a sense of how serious the problem of hepatitis is in Zambia. Dr. Mulenga is also the national focal point person on hepatitis.
What we've noticed over the years is that there's been an exponential rise in the amount of blood that we are discarding due to hepatitis B. Hepatitis C was never there up to the late 1999, there about 2000. That's when we started noticing, hepatitis C being prevalent among our blood donors. But hepatitis B has been a major factor for most of the blood that we discard after testing. It is more of a problem now than even HIV from the blood transfusion perspective. What I mean is that whereas we've put in measures to try and control HIV and reduce the prevalence of HIV among the blood donor, and also reduce the discard of the blood that is, destroyed as a result of the HIV infection. We've not managed to control hepatitis B.
Many are more afraid of HIV and AIDS than hepatitis. Perhaps it is because they do not know much about the disease. We have been finding out from the streets of Lusaka what people know about hepatitis.
It is a disease, but I don't know the kind of the disease.
Nothing. I think my knowledge is basic. I know there should be hepatitis A, B, and whatnot. Other than that, I have no idea, but I assume it's a sexually transmitted infection.
Hepatitis? Yes. I've just heard of hepatitis. Yeah, but I just know that it's a disease, yeah.
What do you know about hepatitis?
Nothing.
What about you?
I have no idea.
So nkana menti pundisa napo ni akadoyo kamenti itanatika hepatitis B. Akakadoyo kaenda mumagazi. Aini blood contact. Mukankana contact na muntu o kapena mulina nikambe bwanji. Maybe mwazirekerera simunazisamalire mungatenga kakadoyo.
Those who deal with human lives are not taking the disease lightly. At Kanyama Clinic, west of Lusaka, health workers are taking advantage of those who visit the facility to sensitize them against hepatitis.
Namverati kadoyo zinake ni HBV iyo. My difference pali HBV na HIV visi anapati.
But has the disease been given adequate attention?
I don't think so. Even among healthcare workers, I don't think everyone is as familiar with hepatitis as they are with HIV. And yet the problem is actually bigger worldwide. I think you can easily find the numbers of HIV, the 30-something million people in the world. Hepatitis B, let me say chronic hepatitis, which is caused by the three viruses B, C, and D, is about 500 million in the world. So it's much bigger than HIV. And then hepatitis B itself, there's about 350 million people infected worldwide with hepatitis B. And yet a number of those may not even know that they have hepatitis B. And then, as I mentioned, healthcare workers sometimes may not be familiar. So it hasn't received as big attention as HIV has.
There's more information available readily because there's been huge resources that have been put for the fight against HIV, and this has put hepatitis fight, in the background. So there hasn't been concerted effort, focused effort on hepatitis. Now, the inoculum that is required for you to acquire, meaning the amount of virus, the dosage, for lack of a better term again, the amount of virus that you need to get infected, it's minute quantities for hepatitis. It is, when we call picograms, it means sometimes you cannot even see it with the naked eye. Do you understand? So it is a very, very small virus compared to the HIV.
It's just simply because someone is fat and the program failed to go through.
In most cases, people usually seek medical attention when it is already too late. But is this the case with hepatitis?
Unfortunately, we see patients when sometimes when they have developed liver cancer and cirrhosis. But through routine testing, we have caught a few patients in an early stage when they are just exposed to the virus. And these are the patients who are lucky in the sense that we will screen them, do certain tests, and if they qualify to go on medication, then we put them on medication.
What are the advantages of early detection?
Hepatitis B virus can cause acute, which is a sudden clinical syndrome, and a chronic clinical syndrome. And the chronic one is the one that we fear the most, which is where the virus is left to replicate in the body for many, many years, even several decades. And it causes inflammation inside the liver. And a lot of times patients aren't aware of that. Well, over time, the liver becomes damaged little by little by little until one of the end-stage complications occurs, which is what we fear the most. And that would be when the liver is in failure or cirrhosis. And also that would be another type of complication is liver cancer. And so generally, we want to detect the viral infection at an earlier stage so we can prevent any of those complications.
It is often referred to as a silent killer disease. But what are the symptoms of hepatitis?
So if you have an acute episode, some patients may be asymptomatic, meaning they may not present with any symptom, and they may not even realize that they have it. Others will present with flu-like symptom, okay, body aches, fever, okay, headache, and then they may also have jaundice, that's yellowing of eyes. Okay, but this may just disappear, especially in an acute form. Thereafter, if the virus goes into chronic form, this is where now it may surface with the virus now causing what we call cirrhosis. And this will present with swelling of the tummy because of fluid accumulation in the tummy, and also swelling of legs. And some patients, in fact, may also present with yellowing of eyes from time to time. And others also, if it now becomes very complicated, they may present with what we call hepatic encephalopathy, meaning the pathophysiology is that the patient becomes confused, okay, because of the disease process to affect the brain, okay, they may be confused, they may become comatose. That is when the liver is really damaged, okay, and they may be convulsing, things like that.
Clinic 5 at the University Teaching Hospital, UTH, is a busy place during lunchtime, because many come through to have their liver checked. A fibroscan device is used to assess a patient's liver. With a patient lying supine, an ultrasound-like probe is placed on the skin over the liver area. The test takes about 15 to 20 minutes to perform, and those who have had it say it does not cause any discomfort. What treatment is available for hepatitis?
So when we diagnose a patient with hepatitis B virus, first we check the HIV status, and if the patient is HIV positive, we refer them for ARVs. But if they're HIV negative, which is very common, it's very common to find a patient who has hepatitis B and is HIV negative. The next thing we do is we assess the liver to see if the virus is in an active form, where it's causing a liver problem, or inactive, where it's not causing a liver problem. And if the liver has damage or we find an active infection, then we prescribe a medicine called tenofovir or Truvada. They're two different medicines, which are actually a type of ARV that was discovered later to also work in hepatitis B. But if we find that there's no liver damage or the infection seems to be inactive, then we just follow the patient up every 3 to 6 months, because some of those patients do later need medication. So I often find that patients, we have to do a lot of health education so that they understand that whether they're on the medicine or not, they should be coming in to have a follow-up at least twice a year.
The hepatitis B vaccine is critical to hepatitis B prevention. Dr. Crispin Moyo, who is a clinical care specialist at the Ministry of Health, now explains more about the vaccine.
All children born in Zambia are vaccinated against hepatitis B. So from around about 2006, 2007, we started vaccinating all our children. So kids who were born around that time, they will already be vaccinated against hepatitis B. So it's the older population like ourselves who didn't have a chance to get vaccinated when we were young. For healthcare workers, there is no program yet to vaccinate all the healthcare workers. but it's something I think that as part of our scaling up of activities against viral hepatitis, that will need to be included, that every health worker, every student who is working in the health sector, and the other people that are working in the health sector, they will need to be vaccinated against hepatitis B.
Before you were diagnosed with hepatitis, were you aware about the disease?
No, I wasn't aware. The doctor told me that I was affected through, drinking that's contaminated water. In fact, everyone in the villages or in the community, they are not aware about this channel. If they can just start sensitizing about the same problem and teach people about how they can contract these diseases. Otherwise, everyone will die of the same problem.
Let's be jealous to our bodies. Whatever you feel bad, good to your body, please, you need to rush to the hospital. When you don't know something, you become like ignorant. But when you know it, definitely you are more like saving your life, saving somebody's life. But what I can advise to all people in the community, we need to go for a routine checkup so that you know the body if you've got this hepatitis.
Raising awareness and getting tested is the first step to get the problem under control. And I think government is aware of that, and they're supporting more testing for hepatitis. Then the second is full implementation of vaccination. So according to the policies in Zambia, we should be vaccinating all babies at 6 weeks, 10 weeks, and 14 weeks for what's called the pentavalent vaccine. And in that pentavalent, the ministry has put hepatitis B. So the next generation of children born in Zambia should have much less hepatitis. But the challenge comes in where, as you know, not every mom takes the baby for all 3 jabs or all 3 immunizations. And also, if there are delays in receiving the first immunization, then the child may still be exposed to hepatitis B.
As a country, I think we need to be aware that hepatitis B is around. It's very infectious. The universal precautions that we promote for prevention of spread of HIV are the same. Safer sex practices, use of no sharing of sharps and needles, proper disposal of all razor blades that we use in our homes for many things. All that will eventually lead towards elimination of hepatitis B, new infections.
Hepatitis is a silent killer, and medical experts advise that people should have themselves screened for the disease at least once. Well, that's all we had for you in today's edition of News in Depth. We were looking at hepatitis, which is highly infectious than HIV. Join us next week with another program. Thank you for watching. From me, Effie Mpande, and my camera operator, Tamara Nyurenda, and the rest of the team, it's goodbye and God bless.